that we didn't get here on time. So we're going to change the program a little bit and do our we were going to do a meet and greet between 1:30 and 2. But let's go to our program. We'll do the press conference, and then we'll start our meeting shortly after that. I want to thank all of you for joining us, and we're obviously here to talk about children's dental health and the importance of protecting access to dental health and dental health services. We are just honored and delighted to have Assembly Speaker-elect Karen Bass with us today. And I'm just so grateful that she was able to join us because, as you know, she has a big event on Tuesday. Her swearing-in ceremony is on Tuesday, so this is probably the busiest week, and she has graciously agreed to come and spend the afternoon with us, so we're very grateful for being here. As many of you know, Speaker-elect Karen Bass is the first African-American woman in the nation to serve in this role, and the first Democratic woman in California's history to hold this post. You may know her work already as a champion for children, especially making foster care issue a key priority for the state, and it's really an honor to have her with us. I also wanted to thank Kathy Watt from the California Dental Association for joining us, and Dr. Turley will also be speaking on behalf of the California Dental Association. Obviously, a little bit later on, we are going to tour this wonderful clinic, and you know we could not have done this without the CEO, Joel Garcia, who's with us today. Thank you for hosting us. Mr. Garcia was the past president of the California Primary Care Association and has been very active in Sacramento. We also have our mayor, Hayward Mayor Mike Sweeney, with us today. Thank you for coming. And I see our council member Barbara Holliday and council member Diana Souza. We also have the Chabot Las Positas Community College District President, Carlo Vecchiarelli. Welcome. And Castro Valley Unified School District Board Member Joe Loss. And also the incoming president of the state PTA, so welcome. I also wanted to thank Melinda Miller, Executive Director of Southern Alameda County Dental Society, for helping us with this event. And Lori Baptiste, where are you? Lori, as you know, is everywhere. She's probably working outside. Also, thank Lori for helping us pull this together so quickly. Let me just say that you've been hearing a lot about the budget issue in Sacramento and the kind of budget challenges that we face. And it is so important that we're gathered here to talk about dental health because California right now only has 4,000 dentists who are able to see, who are actually seeing Medi-Cal children and families for dental services. 4,000 or 6.6 million children and families. And in the last 7 years, they've actually taken 25% reimbursement rate cut. And you know, dental health is a national issue. Last year, as many of you remember, a 12-year-old boy died in Maryland because all he needed was an $80 tooth extraction, and the family didn't have health insurance, and basically his infection went to his brain, and as a result, the family spent $250,000 in emergency services, declared bankruptcy, and the boy died at age of 12. So, let's just bring this home. In Alameda County, in California, first, in California, 1 in 5 children did not visit a dentist in the last year. And dental problems are the leading cause of school absences in California. 2 years ago, 500,000 children missed school days because of dental problems. And in Alameda County, more than 2/3 of the third graders have already experienced tooth decay. And the picture is even worse in low-income schools, with 44% of third graders having untreated tooth decay, compared to 18% in higher income schools. And Dentacal already has, like I said, has major cuts over the years. But we're looking at going from 400 million to 300 million. I mean, we're going to lose a lot of providers and children and families. Nationally, dental care represents about 4% of the healthcare expenditures. In California, it's less than 2%. And 2006, the California legislature enacted AB 1433, which the bill requires all children, all kindergartners and first graders to get oral health assessment. It's required now. But the bill didn't provide any funding. I ran a legislation last year, AB 834, trying to fund school-based preventive services, dental services. It got out of Assembly 79-0. It had bipartisan support, but the governor vetoed the bill. And it is so important for us to come together today and put our support behind dental health services for children, because this is an important health care for our kids and our families, and we have to make it a priority.